Good afternoon, everyone. My name is Kim Bittner, and I'm with the ESRD National Coordinating Center. Thank you for joining us today for the ESRD NCC Patient Education Webinar event. The ESRD NCC webinar events are held in partnership with the Centers for Medicare and Medicaid Services. The calls feature patient and professional subject matter experts from around the country sharing how they or their organization are coping with situations related to COVID-19. Before we get started, I wanted to let you know this call is being recorded and will be posted on the NCC COVID webpage, usually within 3 business days. Many times we will have the recording up on the web page well before 3 business days. Let's take a look at the agenda for today's call. Today, we are pleased to have Allison Boutwell, a licensed clinical social worker who is the Patient Services Manager with the Florida ESRD Network 7. We are also joined by Derek Forfang, a current transplant recipient and the co-chair of the Kidney Patient Advisory Council. We'll introduce them in greater detail shortly. Our topic for today is understanding the role of network patient services during COVID-19. After their presentations, we will have time for questions and answers. This does not mean you have to wait until the end of the presentation to ask your questions. As your questions arise, please submit them using the chat or question feature through WebEx. Our goal is to answer as many questions as time allows. If I can have the next slide. Before we start with our presentation, we wanted to remind you of the resources available on the NCC website. There are many online resources for patient and family members, such as what to expect as a newly diagnosed patient, understanding the grievance procedure, choosing treatment options like transplant or home dialysis. There's also information about infection prevention, emergency planning, and caregiving. Several new resources were added on topics related to traveling, hospitalization, participating in plan of care meetings. And for this information, please visit www.esrdncc.org/patient. And if we can have the next slide. So what is this call about? You will hear tips to empower yourself to cope with COVID-19. We will share some real-world experiences that you can put to use. We have some resources for you to share with others. And this is a series of calls that's available to you bi-monthly, offering a variety of topics. So let's go ahead and begin with our presentation. And at this time, I'd like to introduce you to Allison Boutwell. Allison is the Patient Services Manager, as we stated, at Health Services Advisory Group, ESRD Network 7. She received her Bachelor of Science degree in Psychology from Tulane University and her Master of Social Work degree from Florida State University. At Network 7, Allison works as a dialysis patient advocate. Her work focuses on addressing patient grievances, preventing involuntary discharges, leading the Patient and Family Engagement Project with dialysis facilities, and supporting members of the Patient Advisory Council. Welcome, Allison. We appreciate you joining the call today.
Hello, and thank you so much for having me today, Kim. All right, we'll get started. Next slide, if you will. Oh. All right, so we wanted to start by giving an overview of what the networks do. There are 18 ESRD networks throughout the country. Network 7 covers the entire state of Florida, which includes about 500 dialysis facilities and more than 33,000 dialysis patients. We are tasked by CMS to provide quality improvement, data management, grievance investigation, technical assistance, as well as patient and professional education services. Our goal is to efficiently and effectively increase the quality of care and quality of life for patients with kidney disease. Next slide, please. My role as the Patient Services Manager is to first and foremost be a patient advocate. I work to resolve patient grievances using mediation and conflict resolution. I also provide education and training to dialysis facility staff on managing a variety of different patient concerns. Most patient services managers are licensed clinical social workers with years of dialysis and/or kidney transplant experience. Next slide, please. Since the beginning of the COVID-19 pandemic, the networks have taken on several roles to assist both patients and facility staff through this difficult time. We educate facilities on COVID-19 guidance and any changes to it. We educate patients and dialysis facility staff on COVID-19 prevention using CDC resources. We help dialysis facilities identify the source of COVID case increases and provide resources to decrease those cases. We also advocate for patient rights and maintaining outpatient access to care. Next slide, please. The network sends out weekly emails with a variety of COVID-19 education. I included several examples here, but of course some of this changes based on the resources available. No matter what, we encourage facilities to stay up to date with NCC, CASER, and CMS resources. Next slide, please. The network also sends weekly emails to all facilities with the most up-to-date CDC guidance. We encourage facilities to stay up to date on this guidance and to utilize the CDC tools. I included some examples here, and I encourage you to take a look at the CDC website if you have not already. They have weekly summaries, the COVID-19 vaccination toolkit, how to select, wear, and clean your masks, and outpatient dialysis facility preparedness assessment tool. Next slide, please. My colleagues here at the network complete weekly technical assistant calls to facilities who have seen an increase in COVID-19 positive patients. I've included some examples of the questions that we ask, such as, how are the COVID-19 patients being identified? What is the screening process at the facility using for all patients? How many of these are nursing home patients? And if so, has the facility been in contact with the nursing home? Is there additional screening for those nursing home patients? What actions are being taken by the facility? Were any infection control audits performed, for example? What does the facility think is working best to control the spread? And what barriers are the facility experiencing? Some examples of barriers that we've heard include patients not wanting to follow the policies and procedures, transportation issues, and staffing shortages. Next slide, please. During the COVID-19 pandemic, the role of the patient services managers continues to be, first and foremost, advocating for patient rights and maintaining their access to outpatient dialysis. Patients can always call the network with any grievances they may have. Some examples of grievances that we've received specific to COVID-19 are communication issues. For example, staff not properly communicating why patients are considered as under investigation for COVID-19 and what the next steps are. They use the term PUI, which stands for Person Under Investigation. Professionalism concerns. Staff maybe treated a patient differently after he or she was diagnosed with COVID-19. Screening concerns. The facility was not properly screening patients or staff when entering the facility. And then sharing of information. Patients maybe were not told when there was a COVID-19 positive patient or staff member with whom they were in close contact. And then masks. We've received a lot of these grievances. At the beginning of the pandemic, these grievances focused mostly on patients not wanting to wear a mask or wanted to wear their own mask during dialysis. More recently, we've received grievances from patients who are concerned about other patients not following the masking protocols. For example, patients taking off their masks to eat in the facility or wearing their masks under their nose. Next slide, please. So, one of our goals is to share best practices with dialysis facilities. Some examples of these best practices include screening all patients and staff for COVID-19 when they enter the dialysis facility, including temperature checks, questions regarding symptoms and exposure, ensuring that all patients are wearing a mask. Many companies require patients to wear a new surgical mask during each treatment. maintaining social distancing protocols for patients and visitors in the waiting room, ensuring that CDC, local, and state guidelines are followed for infection control, properly sanitizing surfaces, and proper use of PPE are included in those. Next slide, please. So if a patient is deemed, if a facility deems that a patient is under investigation for COVID-19 or finds out that a patient has tested positive for COVID-19, that patient will most likely be moved to a designated shift or a different facility. Most dialysis organizations have these designated facilities or shifts for 4 different treatment groups of patients to ensure that they continue to receive their dialysis treatments. They have PUI symptomatic, patients displaying symptoms of COVID-19 who are awaiting test results, PUI asymptomatic, which might be patients who have been in close contact with a COVID-19, a person who has tested positive for COVID-19 and are awaiting test results, but have not been exhibiting any symptoms. And then, of course, you have the COVID-19 positive patients with symptoms and COVID-19 positive patients without symptoms. Next slide, please. So what is the role of dialysis facilities in all of this? If patients test positive for COVID-19 or are deemed PUI, dialysis staff should work with the patient to explain their options and what to expect when it comes to cohort facilities or shifts. This includes answering questions such as, where is the cohort facility? When is their chair time? The facility needs to assess if there are any transportation barriers, explain what criteria need to be met before the patient can return to their home clinic, explaining what would happen if the patient continues to test positive for a long time but is no longer considered infectious, explaining that the home clinic will keep the patient's chair time available for them until they return, as we know that that is a concern for a lot of patients. Next slide, please. I wanted to give a couple case examples that we've experienced here in Florida. The first case began when a patient contacted the network because he believed that he was being denied dialysis unfairly. The hospital where he was receiving treatment explained that he was considered a PUI for COVID-19 due to presenting symptoms of the virus. However, he felt that these symptoms were also very common side effects of dialysis, such as shortness of breath, fatigue, muscle pain, cough, and headache. He was told that he could not return to his home dialysis facility until receiving a negative COVID-19 test. Next slide, please. So with the patient's permission, I opened a grievance immediately and contacted the dialysis facility. I did receive clarification that per their facility policy, the patient couldn't return to their home facility until receiving that negative COVID-19 test because he was considered a PUI. However, the facility had already offered treatments at their PUI cohort facility. The issue is that the facility was 45 minutes away from the patient's home. I then reached out to another dialysis company to find out where their cohort facilities were located. I was able to advocate for the patient to receive a transient treatment at a nearby cohort facility that was only 10 minutes away from the patient's home. I also advocated for the patient to receive a COVID-19 test at that cohort facility. Next slide, please. The barriers in this case were that the cohort facility for this company was 45 minutes away for the patient's home, and the transportation company that the patient used for dialysis refused to transport anyone under investigation for COVID-19. And the patient didn't have access to his own transportation, including transportation to go get the COVID-19 test. So even though the facility was offering an option for this patient to dialyze, it wasn't an actual viable option for him due to these barriers. Next slide, please. This case did have a positive outcome. The patient only had to treat on a PUI shift at the cohort facility for one treatment. He was able to arrange transportation with a friend for that one treatment, and then he tested negative for COVID-19 and was able to return to his home facility for the very next treatment. Next slide, please. Case number 2 began when a patient called the network with concerns about the facility's COVID-19 screening process. This patient was actually exposed to a COVID-positive family member, making the patient a PUI. The patient's home facility had a PUI shift later in the day, which they offered to this patient. However, the patient was concerned about attending because of changes that she saw in the screening process. At the beginning of the pandemic, the facility staff met the patients at the lobby door and screened and provided masks. However, more recently, the facility was allowing patients to enter the lobby and then screening them before they entered the treatment floor. The patient reported that this led to some patients sitting in the lobby without masks if they did not bring their own mask from home. Next slide, please. With the patient's permission, I opened a grievance and immediately contacted the dialysis facility. The network reviewed the dialysis facility's policy on screening for COVID-19. We confirmed that the facility was continuing to follow its screening policy, which allowed for screening on the treatment floor. However, the facility was not following its policy regarding masking and social distancing in the lobby. So we advocated for the facility to implement best practices, both screening and providing masks immediately when patients arrive in the lobby. Next slide, please. While speaking with the dialysis facility staff, we discovered several barriers that they were experiencing. The first was staffing. Staffing shortages led to difficulties of having a staff member at the front door when patients arrived. The other was personal protective equipment. The facility tried leaving a box of masks for the patients at the front door. However, those boxes were being stolen, leading to PPE shortages. Next slide. The outcome was again positive. The facility was able to implement best practices, including screening patients at the lobby door and handing out masks. The manager agreed to complete audits of the screening process to ensure that it continued properly. The patient was able to return to her home facility on the PUI shift, and then, after testing negative for COVID-19, went back to her regular treatment shift. Next slide, please. So we want to encourage any patients on the call today who are experiencing issues or concerns with their dialysis facility to call the ESRD network in your area. You can find the contact information for your network on the NCC's website, as you see here. And now I will hand things back over to Kim.
Thank you very much, Allison. We appreciate that information. At this point, I'd now like to introduce Derek Forfang. Derek Forfang has been a type 1 diabetic since the age of 10 and an ESRD patient since 1999, utilizing various treatment modalities, including transplantation, peritoneal dialysis, and in-center hemodialysis. He is the chair of the National Forum of the ESRD Networks, Kidney Patient Advisory Council, which is also known as KPAC, and a member of the Forum Board of Directors. He is the chair of the HSAG ESRD Network number 17, Patient Advisory Committee, and the chairs of the Network 17 Board of Directors. He serves as the chair of the National Kidney Foundation's Kidney Advisory Committee and chairs of the NKF's Public Policy Committee. He is also a member of the Kidney Health Initiative Patient and Family Partnership Council, as well as Derek has served on the NPFE LAN various affinity groups in the past as well. At this point, I'd like to turn it back over to Allison, as the two of you are going to talk about the dialysis patient grievance toolkit, which is part of the, or came from the National Forum of ESRD Networks. Allison?
Thank you, Kim, and thank you, Derek, so much for being here. I will jump right into our first question for you. The KPAC created the grievance toolkit, which I offer as a resource to patients. When was this resource created and why was it initially developed?
Well, thank you for inviting me to the call, first of all. we had talked about transparency and the need for transparency for grievances. We felt it wasn't well understood even between us as patients on the KPAC and staff members as well at the clinics. The facility technicians and various people really didn't understand the process of a grievance and what it was all about. So we took that on with help from our network staff that chipped in and helped us. And it was finalized in 2016. And we really realized up front that a grievance is really a quality tool. And earlier in my career, we had looked at, and this was before Amazon and all those things, we had looked at a program that came out of the San Jose State University here in California, and they had a quality through corrective feedback process. And now you see it everywhere. I mean, everyone wants your feedback when you're a consumer of their goods or their services. I belong to a group where I got points to eat at a place, and by the time I had lunch, there was a survey on my email waiting for me to look at. And one time I did comment about their menu needing some lower prices for lunch, and they rewarded me, a gift card for $25 for giving them feedback, even though the feedback was a little on the negative side. But many times we see in dialysis facilities, you may not have an environment that fosters and welcomes feedback. And so we wrote the tool to make sure patients understood their rights and their responsibilities, and some tips on how to get a hold of the network, first of all, and how to address problems and understand that the negative connotation around filing a grievance, it really should be welcomed and looked at as a way to improve either short-term or long-term quality in a facility.
That's fantastic, Derek. Question number 2, as the KPAC was developing the grievance toolkit, is there anything about its development that really stood out to you?
Well, I think just the fact that many patients, and I'll use myself as an example, had never filed a grievance, never really understood the process. It felt kind of scary to think about that. We ran into issues around, barriers and limitations for patients to file a grievance, whether fear of retaliation came up a lot. So it made us really have to think about, how we could put something together that was a document that was friendly, but laid out in a manner that took feedback seriously. It really touched on a couple different barriers. You could be too ill and not have a voice. There could be other issues that may prevent you from working with your own facility. And we wanted to make sure they understood who the network was and that you could call the network, whether it be a formal grievance process or questions, maybe a communication issue, maybe a lot of things that come from a grievance, misunderstandings, or it may be an actual case. We've gotten calls since COVID of a dialysis facility in New York who contacted one of the KPAC members, someone from there, and said that COVID patients who tested positive were separated from the other patients, but they had to wait outside to get until their time for their treatment. And it happened to be a very hot time during the summer, and they had a person pass out. And so the network was contacted, and it was resolved that day to make sure that patients were safe. So there's many things we see as patients when we're out there. And so a grievance could be something individual for us, or could be something mentioned that could help others or even the whole facility just have a better experience with dialysis.
Absolutely. I'm glad you mentioned I have a lot of patients that call that are very nervous to make a grievance. And so I know that that's very, very true and very real for a lot of patients. So this toolkit is fantastic for them.
Yeah.
What do you see as the greatest?
Matter of fact, I'll share something with you before we move on. You know, even this morning, I had a fellow patient. We were talking on during a call, and they had informed me that they were at a clinic in the past, and the facility administrator would actually yell at patients, actually got in confrontational arguments with patients, told them, you know, if they don't like it, they could leave and go somewhere else. Well, if you're watching that, even if you're not treated that way, really intimidating then to just say, you know, by the way, could we have some changes in here and make this a little better? I mean, that's the last thing you're going to want to do after you witness that. So I think it, you know, it really can change and set the tone for a facility. And you almost like a facility has a personality. I notice it, especially when I was traveling and going to a lot of dialysis facilities before my transplant. You can feel an openness and friendliness, or people are just really focused on getting people in and out, and it's not quite as open and friendly. So you know, I think it does. It is an issue for a lot of patients, and I think the network is really there to help us navigate through those touchy situations and keep us safe, but get our, you know, voice to the actual facility.
Absolutely. But patients have to know about the network and how to utilize us, right? So
exactly.
What do you see as the greatest value of patients having access to resources and tools such as the grievance toolkit?
Yeah, well, if you don't understand the process, how are you expected to really get involved in it and utilize it? I think, you know, many times we get some information, but we don't hear from other patients or hear things that you can really completely understand. And so I think getting information from patients and from the networks and from facilities, and to really kind of wrap it around to really understand, you know, like I said, what your rights are. You should be treated with respect, no matter who you are, no matter the color of your skin, or any of those other issues. We all should be treated as equals. And I don't think that, unfortunately, still doesn't happen all the time. And it's still not, in many clinics, it's not as friendly as other clinics. So it can become a real issue. And I wished it was not. And I wish it was seen as, you know, as the restaurant I used to go to, or back when no COVID was around, where they just welcomed that feedback and wanted to satisfy everyone. But I don't think we're quite there with dialysis facilities yet, at least not all.
Absolutely. So that brings us into the next question, which is, why do you think it's important for patients to understand their rights and responsibilities?
Well, I think that might help from the onset of things to really understand, you know, like I said, not only what your rights are, but you're also accountable for your care. You're accountable, you know, for a list of things that are included, and those come from CMS. And much of the information in the grievance toolkit comes directly from CMS. But I think it's important for us when we go into a situation to understand what part is ours, what part is the facility's, what the network can actually do for us. Like, the network can't come in and fire someone because you don't get along with them. Because I've heard in the past that's been one of the things patients have called in and wanted to see happen. And that's
yes.
not always the case. You know, the networks have limitations, and, you know, but they are a fair voice and balanced voice that can come into a situation and in many times, like you've described, resolve it, you know, in a manner that is good for the patient and good for the facility.
Absolutely. We're all about quality improvement, so not firing or hiring, but just improving the quality of care.
Yeah, exactly.
And have you ever had a personal experience with filing a grievance?
Well, I actually, one of the things is I was, during about 8 years of my dialysis, I didn't know the network existed until I was asked to actually serve on the PAC. And I think that's been a big issue too. That's been tough to get. Many of us come in there, we want to get our treatment done and pretty much get out of there. And I didn't look around a lot at what was in the lobby. I did a little bit, and then once I actually knew about the network, by then I was pretty, I just was much more educated about how facilities worked, what was going on, and I was able to navigate, some issues that I had. And actually, there was an issue that I could have filed a grievance on. It was a very difficult issue, but I was able to work through it at the facility. And hopefully, most of those issues can be dealt with at the facility. But if you can't, that's what the network's there for you. So, no, I've never filed a grievance myself.
Absolutely. All facilities have a grievance process, an internal grievance process, but when the patient doesn't feel like that's working, the network is here. What advice would you give to someone who's considering reaching out to the network but maybe a little hesitant?
Yeah, I would always advise people to feel safe when you contact the network. The network, especially, the folks, they're there for us. So to feel like it's a safe place to go and talk about what issue you're having, and get some guidance, or whether it's a formal grievance that you need to file, or I think the network's just there for you to help, or maybe information that can be shared with you, some resource. So I always think that the network is a great place for patients to contact, stay involved, to look at what resources are available, educate yourself, so that's what I would tell a patient is it's a safe place to go, and if you find out what you need in one call, that's great. And if you need a little more help, well, they're there to guide you through whatever issue you're having.
Absolutely. And for patients that are incredibly hesitant, we also offer them the option of filing anonymously so that they, feel like they can still address the grievance, but if they're afraid of the facility knowing who it was. So that was always an option as well.
Yeah, that's really critical. We had a member of the KPAC that actually filed a grievance but made it very vocal. And it was just something small, but they didn't say hello to him and welcome him when he came in the facility anymore. No one really came up and had a conversation with him from the staff during his dialysis. Everyone was professional, but they were just not welcoming. And just that by itself caused him to feel rejection, depression, had a major impact on him. So I think we need sometimes to be able to do things in an anonymous way, to protect ourselves or have our families call in and also be protected. So I think the networks can be a great resource for a family member as well.
Absolutely. We get family members who call in all the time. If we're going to use the patient's name, obviously we have to have direct permission from the patient. But other than that, we can certainly do anonymous grievances, and it's always a good resource for families. Also just to talk about what dialysis means for their family member and get more information.
Yeah, exactly.
Well, thank you so much. I am going to hand things back over to Kim.
Okay.
Thank you very much.
I think we have another slide, but I want to just let everyone know you can get the grievance toolkit on the forum of ESRD Networks website. And so it's available there under toolkits, patient toolkits. And there's also several other toolkits you can look at: Transplant, depression, financial tips. So please feel free to go to just Google ESRD Network forum or the forum of ESRD Networks, and it'll pop right up.
Thank you both for sharing all this information and for that great discussion that you had just about the whole the grievance toolkit. What we have up on the slide right now, as Derek discussed, was how you can gain access to the dialysis patient grievance toolkit. As well as, Derek, you provided your email address, so we left that up there in case anyone had any specific questions related to your work with the KPAC, so we left that up there. And Derek, we did include the quote. Matt, if we can go back one slide, we did include the quote. This is a quote that's within the toolkit, and I didn't know if you wanted to speak to this at all. I know that it's a quote that was that you had included.
Sure. Well, I just, you know, and I think the folks on this call especially understand that how important the patient's voice is, and you should never second guess the power of one voice, because one voice brings about change, and it lets others know when they hear that voice that it's safe to share their voice. We all make an example, lead by example. And I know many patients that I deal with from the networks, matter of fact, almost all patients, I would say, understand the power of your voice. And sometimes we have to be the voice for others. So I think, you know, never second guess speaking up and telling people how you feel or what's good or what you feel is not, because I think that's what really starts change and may create large change. You just never know. That helps, you know, may help 100 people. It may help your facility. It may help every dialysis patient. So speak up if you see something that needs to be improved, or you see something that you like a facility to continue that works great. Let them know, because I think it's only through our feedback that we'll see improvement that will help ourselves and others, you know, deal with kidney failure, dialysis treatment, and those types of things. So I think that was not my quote, actually, but I love it. And it was one of the other patients that worked on the toolkit, but I think it's just a really powerful statement.
And thank you for sharing that with us. Right now, it is now time for questions. We want to hear what your questions might be. So if you haven't done so already, go ahead and submit any questions that you might have either through the chat or the Q&A through the WebEx. We do have some time, so and we have received a few already. But this is your time to ask any questions that you might have of either Allison or Derek about the information that's been presented. And so I'll go ahead and start with what we've received. We have one here. This looks like it's for Allison. Allison, since the pandemic started, are the networks, or at least your network, are most of your requests from patients related to COVID situations?
I will say that we had a lot at the beginning, and now, no. Actually, most of my grievances are still related to, you know, everyday dialysis things that all the patients go through on a day-to-day basis. But we certainly do continue to receive some grievances related to the pandemic. The most recent was a patient who was concerned about other patients not following the masking policy in the facility. We know that since this has been going on for almost a year now, people are tired. You know, it's difficult for patients to sit for 3 to 4 hours without eating or drinking, which is one of the new rules at most facilities. So we are seeing that other patients are concerned about their own health, you know, if another patient is not wearing their mask or is taking it down to eat or drink, just as an example.
Okay, thank you. Another question, what happens if a patient does not want to go to a cohort facility? Allison, that's probably most likely for you.
Yeah, that's a good question.
That's a pretty broad question.
It is. So my case example was sort of an example of that. He did not want to go 45 minutes to a cohort facility. Unfortunately, the company where he received dialysis just did not have another option, which is why the network got involved, and we were able to find another option for that patient. So, facilities are a little bit limited as far as what resources are available, and that's why we encourage reaching out to the network if you've exhausted all of those resources.
Perfect.
Thank you. Derek,
I could comment on that, Kim, too. I know we have patients. I've heard from across the country, actually, we've had patients who don't want to go to those cohort facilities and won't necessarily be sharing, that they have somebody at home that may have COVID or may have been exposed, so they can stay in their home clinic. And I think we as patients need to remember that, we're all in this together, and we need to speak up if something's happened, even if it puts us out, but we need to protect each other. So I think it's important that we encourage others to be transparent about what's going on with them, and if they're not feeling well or they have a fever, or if their spouse or someone in their household has it, to bring that forward, because we're all trying to get through this, and it's been a really tough year. We lost friends, and we need to get this to stop.
Thank you for sharing that, Derek. And that actually segues nicely to the question that came in for you. They asked, when did you start becoming involved with helping other organizations? It's something I'm interested in. Where do you find your motivation?
Well, my motivation, I actually, in my younger years, in my 20s and 30s, I did a lot of work with the Juvenile Diabetes Foundation. I've been diabetic since I was 10. And then once I actually first experienced kidney failure through my grandfather. And he was type 2 diabetic and really didn't deal with dialysis very well. And, he lasted about 4 years. He was in his mid-60s when he passed away. And then I had kidney failure, and partway through, my mother developed kidney failure, and she did even worse, and just a lot of depression, a lot of trouble dealing with the changes in her life, and only lived 1 year on dialysis, and died at 60. So I've witnessed a lot and been through a lot, daily calls with my mom, trying to cheer her up. And she just felt she was a burden to my father, and just had such a difficult time. And I look at what I've been through, multitude of surgeries, and now in a wheelchair and dealing with all this stuff. And I have a good life, but I don't want to see anyone else go through what I've gone through, or what my mother went through, or what my grandfather went through. So that's my motivation, as well as to my donor family. I think my last kidney transplant really saved my life. I was on the emergency transplant list. I had a catheter left in my leg. I'm all worn out as far as my vascular system goes. So it was my last shot, and so I want to pay that forward as well. But I just, when I go up on Capitol Hill or do anything that I do, I tell them that not on my watch should people have to experience the things that I've seen or went through. And so I ask them for that same commitment that, under their watch, they should make sure that no child or young adult has to deal with what we've dealt with. And so that motivates me to keep pushing. And I do see successes and see ways that, for us, especially we're on national level with the NCC, and we have opportunities to give feedback that doesn't just help our facility, but can help the whole country and all the patients that are in the country dealing with dialysis and kidney failure in general. So it motivates me. You know, it's like that one success you may get keeps me going, and it just builds to more. So it's so in a way, I almost look at, you know, I was struggling as well, and when I started volunteering, it was a way that I could repurpose myself because I had lost my job. My family life had struggled. I was divorced, ended up, you know, losing my house. It was just like, oh my gosh, how bad is this going to get? And found myself in a position where, you know, I just had time on my hands, but that's all I had. And volunteering and helping others, I think, really saved my life in a lot of ways. So it gave me my purpose back, and it let me use some of the skills that I had, you know, from the career I was working in. And you know, when I really think about it, it really, truly, I think, saved my life. So so that's why I do what I do, and I love every minute of it. Even when I'm not feeling that great, it's better than laying on the couch, and so it just keeps me going.
Thank you, Derek. We also received a question, and Allison, this might be for you. I think the network and grievance procedure is very empowering to patients. What can be done for patients to feel empowered enough to complain when they aren't satisfied and not labeled as a clinic troublemaker?
Absolutely. I hear that from patients a lot when they call the network, that they already have been labeled, they feel like, or that they're worried about being labeled as a troublemaker. So obviously every patient situation is different. Every facility is different. As we talked about earlier and Derek said, you know, some facilities are incredibly welcoming, and some are not. Some are very focused on getting the job done and hopefully giving good quality care, but part of that quality care is making patients feel welcome, right? So I would say that, number one, if you really feel like that's happening, then you can call the network and do an anonymous grievance if you're worried about being labeled that way. That's one option. At the network, we focus on collaboration and quality improvement. And I'm a believer that when bringing grievances, if the focus is on how can we improve this, instead of coming from a punitive perspective, then maybe the facilities will be more open to it. Like, we all need improvement. You know, none of us are perfect. So how can we improve things? That might be a way to address it with the staff so that they don't feel like somebody is a, quote, troublemaker. However, of course, you 100% have the right to bring a grievance to the facility or to the network. It is your right. It is written into the CMS conditions for coverage that you have the right to bring a grievance without fear of retaliation. So it's also concerning if a facility is making someone feel that way.
Yeah. And I would comment, I shared a story this morning about, I used to go down to my clinic after I got my transplant and speak, go around and talk to people. Sometimes a social worker would ask me to come down if someone had an issue like I do, to just kind of give them a little hope. And I met a lady that they actually kind of shook their head when I mentioned her name. But when I talked to her and actually sat down, and, you know, we talk to each other differently, I think, than, you know, patient to patient. But I found out that she was a great-grandmother. She was on dialysis in her almost 80, and she was having to raise her great-grandchildren due to a drug addiction that her granddaughter had, and her daughter wasn't living anymore. And she just told me, she goes, I never thought at almost 80 years old I'd be raising children again. And she was late to her dialysis treatments due to things going on at school, and she was labeled a bad patient. And, you know, and I felt terrible. And I talked to the social worker about that. But I think many times they don't really understand they only understand part of what we go through. You know, I worked with patients in North Carolina on a research study about a year and a half ago, and we were trying to get patients, you know, to really talk about their whole lives during dialysis planning. And there was a patient who was homeless that the clinic didn't even know, the facility didn't know he was homeless. He kept that to himself. And but once he got into the back and had his annual planning session, you know, he was able to bring that out, and they were able to help him actually. But I think there's a lot of underlying things that they might not understand, just because maybe the way it was explained to them or the feedback they got. But I think being able to talk to them or talk to your facility administrator, your social worker, and just say, look, I'm not trying to cause trouble. I'm trying to make things better here. You know, be part of the solution, not the problem. And if they don't understand that, then, yeah, maybe you call the network and you bring it up a level. But, yeah, because you deserve respect, and you definitely don't deserve to be considered a troublemaker when you're just trying to improve the quality of the clinic.
Thank you both. Again, I want to thank you both for the presentation, the information that you shared, as well as this time during the Q&A, and Derek, you sharing your perspective and kind of what brought you to where you are today. We appreciate those perspectives during these webinars. It adds to the discussion. So thank you for sharing that with us today. At this time, we'd like to go. Absolutely. And at the beginning of the call, we mentioned that several new tools were added to the NCC website. And Because Your Voice Matters is one of those tools, and it is designed to help you prepare for a quality assessment and performance meeting. This is a meeting that you might be invited to join, and it gives you the chance to talk to your dialysis facility leaders about your concerns and other patient issues. Learn what to expect and how to prepare if you're invited to attend one of these meetings. Visit www.esrdncc.org/patients and then select for new dialysis patients and then choose QAPI meeting resource. Next slide. As you are searching the web for information, it's important to make sure that you're going to credible resources. The NCC offers a few resources on finding credible information on the internet, and you can find those resources by visiting kidneycovidinfocenter.com and then click on For Patients. Next slide. For our final resource, we want to remind everyone that the kidneyhub.org is a mobile-friendly web app developed by the NCC with lots of input from our patient subject matter experts like Derek. It has information on home dialysis, the kidney transplant process, infection prevention, mental health, and more. Recently, we've added a diet and nutrition section, and you can go ahead and check it out today, and you can do that by visiting www.thekidneyhub.org.com. Ooh, my apologies. www.thekidneyhub.org. Make sure you do that on a smart device, and then go ahead and follow the directions and save it on your home screen. Next slide. Our next COVID webinar events. We invite you to mark your calendars for the next event. They are the patient event is Tuesday, February the 16th at 4 p.m. Eastern Time, and our provider-focused event is next week, February the 10th at 3 p.m. Eastern Time. We'd like to thank you for joining us today. You can visit for more information kidneycovidinfocenter.com and to register for more events, and you can also find additional information on the CASER website at casercoalition.com. Thank you, everyone. We hope that you found this information useful, and have a good evening. Take care.